Module Overview. This module introduces the core concepts, causes, symptoms, and classifications of dementia and Alzheimer's disease. It lays the groundwork for the course by helping you deeply understand what dementia is, what it is not, while clarifying misconceptions, biological processes, and the importance of early detection. You will explore different types of dementia, risk factors, stages, and how these conditions affect the brain, behavior, memory, and quality of life. Learning objectives. By the end of this module, you will be able to define dementia and distinguish it from normal aging, explain the neurological basis and causes of Alzheimer's disease and other types of dementia, differentiate between types of dementia including Alzheimer's, vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia, identify early warning signs and progressive symptoms, understand diagnostic methods and why early intervention matters, recognize the emotional, physical, and societal impacts of dementia. What is dementia? Dementia is a general term for a decline in cognitive function, memory, reasoning, communication, and judgment, severe enough to interfere with daily life. It is not a disease itself, but a collection of symptoms caused by various conditions affecting the brain. Key points: affects thinking, memory, language, problem solving, and emotional control. Is progressive and typically irreversible, often confused with normal aging, but it is not a normal part of aging. Alzheimer's disease, the most common type. Alzheimer's disease is the most common form of dementia, accounting for 60% to 80% of cases. It is a degenerative brain disorder that gradually destroys neurons and brain tissue. Biological features: plaques, clusters of protein fragments, beta amyloid, that build up between neurons. Tangles, twisted strands of another protein, tau, that form inside brain cells. Shrinking of the brain, especially the hippocampus, center of memory and learning. Symptoms progress over time: early, forgetfulness, mild confusion, disorientation; middle, wandering, personality changes, language problems; late, total dependence, loss of ability to communicate, recognize family, or control bodily functions. Types of dementia: Alzheimer's disease, most common, slow, progressive memory loss. Vascular dementia, caused by reduced blood flow to the brain, e.g., strokes. Lewy body dementia includes movement problems and hallucinations. Frontotemporal dementia, FTD, affects personality, behavior, and language. Mixed dementia, a combination, often Alzheimer's plus vascular or Lewy body. Differences between normal aging and dementia. Normal aging dementia: forgetting names occasionally, consistently forgetting names, places, events, slower processing, confused about time, place, retains independence, loses ability to perform daily tasks. Causes and risk factors. Age, most common risk factor. Genetics and family history, e.g., APOE4 gene. Cardiovascular issues, e.g., high blood pressure, diabetes, head injuries or traumatic brain injury, TBI. Poor diet, smoking, and sedentary lifestyle, depression and isolation in later life. Diagnosis and early detection. Early diagnosis is critical for accessing treatment early, though no cure, some drugs slow progression, planning for care, reducing distress for patient and family diagnosis. Tools, medical history and neurological exams. Cognitive tests, MMSE, MOCA, brain imaging, MRI, CT, PET scans, blood tests to rule out other conditions. The global and social impact of dementia. Over 55 million people live with dementia worldwide. World Health Organization, 2024. Emotional strain on families and caregivers is immense. Economic cost, over $1.3 trillion per year globally. Stigma, misinformation, and lack of resources persist in many regions. Addressing stigma and misinformation. Many communities associate dementia with curses, spiritual possession, or insanity. These beliefs create barriers to care and delay diagnosis. Cultural sensitivity and awareness training are vital to combating. Denial, shame, isolation of affected persons.